Hi, my name is Mariela Knuckles, and this is my speech for the second week of Introduction to Public Speaking for Summer Session 1. Today I will be introducing to you all the topic of occupational therapy. What is occupational therapy? Occupational therapy is an important medical career that helps individuals with daily tasks. It's a branch of healthcare aimed at helping people who have physical, sensory, or cognitive issues or delays. Common ways occupational therapists help patients are by teaching new ways to perform daily tasks, demonstrating how to use assistive technology, educating caregivers on how to help them best, creating daily routines that promote independence, and showing strengthening and stretching exercises. It also promotes independence in patients and aids patients in developing their motor skills, regaining mobility, and improving functionality. They may assist disabled or injured individuals as well. Who does it serve? Occupational therapy serves patients with temporary conditions such as strains, sprains, or breaks, those who have disabilities that are physical, mental, or learning, such as sensory processing disorder, developmental disabilities, or amputations, or chronic conditions such as carpal tunnel. I have carpal tunnel, and I have been to occupational therapy several times, and also arthritis. That is another chronic condition that might be treated in occupational therapy. Certain diseases and disorders very often are seen in occupational therapy settings as well, such as cerebral palsy or Parkinson's disease, and those who have a history of a stroke. Stroke patients very often go to occupational therapy because they have to help relearn their fine motor function skills and also their cognitive development. The ages that attend occupational therapy, well, all of them. Newborns, children, teens, adult, and the elderly all can go to occupational therapy if they need it. In the workplace, I've included here a video clip of a pediatric occupational therapy clinic and the day in the life of how they take care of and help children. So what do pediatric occupational therapists do? We're about to find it. So play and social interaction skills. This is very important for children to learn and develop, as well as visual motor skills. Visual motor skills and fine motor development are also often used in helping stroke patients because they have lost a lot of the ability to do certain things. Fitting kids with supportive splints, people of all ages can have these supportive splints if necessary. Feeding skills, a lot of children, including babies in the NICU, fun fact, will need to see an occupational therapist before they are able to be discharged from the hospital. This is because they have not been able to learn how to use their mouth to eat food, and they need help in order to do that. Now, it might not be very fun, but it is a very true fact. It also mentions self-care, which is another very important factor of occupational therapy, and it helps all patients with their mental and emotional health. Tools and techniques. Some of the techniques that are used in occupational therapy include red light therapy and cold laser therapy. What to know about cold laser therapy? Cold laser therapy is typically non-invasive and painless. It's used to improve healing and blood flow to injured tissues, and it's also often used in the formation of this gun-type product that's shown in the picture, and it's put against trauma-caused tissue or other injured tissues, and research shows that reduced pain for some conditions but no increase in functional movement is very often occurring. It may be done as part of a well-rounded rehabilitation program. Some of the tools involved in occupational therapy are resistance bands, which is pictured here. They help with muscle development, the improvement of stretching muscles, and also re-strengthening muscles after there's been some atrophy. Flex therapy bars, pegboards, and therapy putty are all also used. A TENS unit is used. TENS unit, that stands for Transcutaneous Electrical Nerve Stimulation Unit. It uses low voltage electrical currents to relieve pain in several different types of patients, and other objects that are used include dumbbells, exercise balls, and even toys. The annual wages in the U.S. for occupational therapists by state as of May 2023 is shown in this image here. Arkansas is shown here in the lower end of the mid-range for the annual wage, and the top 5 are shown on the left, with California being in first place, leading with a mean wage of $113,550, New York being second, leading with $107,530, Nevada being third with $107,070, and New Jersey being fourth with $105,880, and lastly Colorado with $104,950. So occupational therapy versus physical therapy. This topic is commonly known between a lot of people, especially medical students who are getting a start out in their career path or in their educational path. Occupational therapy is a lot different from physical therapy, but they both do often coincide or can work together if necessary. Occupational therapy has a much more holistic approach. They focus more on emotional and mental health as well as physical health rather than just physical health, which is what physical therapy mostly focuses on. Physical movement approach is the top priority for physical therapy, whereas occupational therapy aims to help with self-care, daily living necessities, and improving the overall quality of life. In physical therapy, they aim to get patients back in motion, perform body movements, and even improve the quality of movement. Thank you all for watching. Here are some other tools and objects used in occupational therapy, including this toy on the left here. And I hope you all have a wonderful day. I hope you've learned something new about occupational therapy, and I hope the subject interests you. Thank you.